safety for her entire career. My colleague, Congresswoman Louise, the floor is yours, my dear.
Thank you, Rosa, and thanks to all of you. I have to praise Rosa here. I've known her before she was elected. We went to Nicaragua together and met with Sandinistas. I don't know. What do you expect from us? A long story. But we have been partners in this issue for a very long time. I'm just delighted with everything she does, and I will tell you that at a hearing when Bill Sack said he hadn't got the authority, Rosa's response was to ask us for it. And so we're still waiting for that, but we're going to give it to them anyway. But I'm so happy to be here this afternoon, and certainly with you champions, and what you've done is really remarkable. And frankly, you have to do it in the absence of federal action. And I've learned so much more than I knew when I got here. I was naive enough to believe as a microbiologist that the FDA was the gold standard. And I have great disagreements with that quite often. But anyway, I think this afternoon you might want to know that the Chicago City Council, 3:30 their time, is going to vote for PAMTA to protect the antibiotics and join, I believe, 8 cities, Tony?
It's 10.
10 now, all right. It's because we have to have, both in this bill and in PAMTA, we have to have the public outcry that they're not going to buy and feed their families adulterated foods. So next week, all Americans across the country will celebrate the 4th of July. With family and friends around the hot grill, a plate of hamburgers, and they expect that meat to be safe, and we hoped it would be. The Department of Agriculture inspects all of our meat and poultry before it gets to the store, but we're here today to say that the system to keep us safe is broken. Just after the Federal Meat Inspection Act became law, USDA 108 years, excuse me, 100 years after the Federal Meat Inspection Law became law, the USDA will still allow dangerous antibiotic-resistant bacteria to enter our food supply and threaten our health. While the USDA recalls the meat with dangerous class of E. coli, it does not believe it can recall meat, poultry, and eggs with salmonella or even antibiotic-resistant bacteria, and you don't need to be a scientist to welcome the question of that ridiculous statement. So last year we had a front row seat to what happens when USDA fails to crack down on food sold with pathogens. March of 2013, antibiotic-resistant Salmonella Heidelberg traced back to chicken produced by Foster Farms in California, and Rosa has mentioned that already. We were baffled by the fact that the USDA didn't issue a recall. So Rosa and I had a meeting with FSIS and asked them why they hadn't, and we were told they didn't think they had the power. But Heidelberg was terribly important because about 40% of the people who were affected went to hospitals, which is extraordinarily high. We don't usually see that with a food poisoning outbreak. So both Rosa and I disagreed rather vehemently with what they were saying. What good is a regulatory agency if it doesn't have the power to regulate? To this day, USDA has not recalled a single packet of Foster Farms chicken related to this outbreak, despite the fact, as Rosa pointed out, that 601 Americans were affected already, and the number continues to grow. It's still out there. So Rosa and I decided if USDA won't act, we will. So this bill is the result of that action. This would explicitly grant USDA the authority to recall meat with an expanded list of adulterants, ending the claims of legal ambiguity. The bill would require the USDA to recall any meat, poultry, or egg product contaminated by pathogens associated with serious illness or death, or resistant to 2 or more critically important antibiotics for human medicine. Now, I want to say something about the resistant bacteria because it's a crisis on our doorstep. Currently, 23,000 Americans die every year from antibiotic-resistant infections, and 2 million persons in the country are affected by them. 80%, as you know, you've heard me say so often, 80% of the antibiotics produced in the United States are fed to livestock and cattle. That's 20% left for human beings. Can you imagine what we are doing to them? The idea of doing that was to let them survive unspeakably unsanitary and filthy conditions, and because it made them gain weight and they made a little more money at market. But as a result, bacteria mutate, they become resistant to antibiotic treatment. When humans are infected with the bacteria, the antibiotics are useless to fight infection. We're squandering the world's biggest breakthrough ever in medical science and creating bacteria stronger than anything we can throw at it. And according to the World Health Organization, in just 10 years, routine infections like strep throat could be fatal. That should have every American, I think, really rising up and saying, stop it today, FDA. And we certainly appreciate all the voices that we've had in helping to do that. I think there are over 400 groups that are supporting what we're doing. But life-saving surgeries, this is the important part. Maybe you think you're not going to get strep throat, but you might have to have dental work. Maybe you have to have a joint replaced, open heart surgery, organ transplant. All of those things are totally dependent on the use of antibiotics to control any infection that might occur. If they become non-effective, those kinds of surgeries could come to a stop. So we urge Congress to pass this legislation to ensure that fewer Americans are sickened by contaminated meat, poultry, or egg products. It's not just about the USDA having legal authority to recall meat and do their job. It is what they are there for, to protect the health and the well-being of the country. Thank you very much.